The Predict, Prevent, Adapt conference held at St Mary's Stadium, Southampton, features a large selection of businesses and trusts from the health sector. They have all gathered together to meet new innovators in the industry and to talk about change to the future of the health service and the way it works.
We have an event that's set up to look at the ways of changing how the NHS works, looking at innovations and having a real input into how things will be done differently in the future. We hear every day on the news about the issues that are with the health service. There are so many new innovations in terms of digital innovations, ways of working, different things that come up in the future that we really need to get introduced quickly to make sure that we can provide better healthcare for people, better treatment for people, and also bridge the funding gap that there is within the NHS. The one key thing that we'd like people to take away today is that there needs to be change in the way that people work. And if we can get everyone together and bring forward those innovations, then that will be a message that we'll be very happy to get out there.
The event is themed by 3 sessions: Predict, designed to shift current healthcare models to preventative procedures; Prevent, supporting health and well-being; and Adapt, showcasing the digital revolution and how this can be integrated into our healthcare. One exhibitor demonstrating the digital future of the NHS was Scan for Safety.
This is something that is going to be rolling out to every NHS trust in the UK at some point in the next 3 or 4 years. It's mandatory by the Department of Health. It's all about traceability and tracking, making sure that we can trace either a piece of equipment or a drug that's used in every procedure within the NHS. We want to be able to say, this came into the hospital at this point, it's gone through this journey through the hospital, it's maybe been implanted in this particular patient, which is really, really important for patient safety. If there's a recall, we can go and be able to track that patient and get to them immediately if there's a problem.
I wanted to know why this event was worth attending for those involved.
Everybody at some point in their lives is going to be involved in the NHS. Maybe hopefully not, but But it's really important to network and for people to get together and to find out about what everybody else is doing, really. We're at this event so that we can promote the Scan for Safety because it will be taking over nationally. Obviously we've come to sort of see some of the other stands ourselves as well and sort of hopefully pick up a few sort of tips and some interesting people. But it's really just to raise awareness of what's going on and what's being worked on within the NHS.
Another innovator at the event was Jonathan, who is involved in an initiative that aims to place the power of our healthcare firmly back into our own hands.
So my directive is a new way that people and communities can help themselves record how they want to be cared for in an emergency, in a healthcare emergency. And we're starting with everyone in the community, but particularly we want people from as young as 18 to start recording selfie videos saying, look, I really want to be an organ donor. We want those people to also say, look, if I'm in an accident, these are the people you need to talk to about how I want to be cared for, and we're trying to make a real change in society. What I'm doing here today is trying to get it to actually work within the communities in Southampton and the Isle of Wight, and what we want to do is actually drop those statements into your GP record, into your hospital record, so that you as an individual can be certain that they're seen in a crisis, and that's the important bit.
This conference aims to bring together people from vastly different areas of the health sector and challenge them all to rethink the way they carry out healthcare in order to fully embrace the ever more digital world. This is Rhea Barton for That's Solent.